I'm really excited to welcome back to Cancer Connections Dr. Rachel Pearson. Dr. Pearson is a clinical marriage and family therapist in Wichita. Her clinic is just near Central on Woodlawn on the east side of town. She provides therapy and education to enhance sexual health for men and women and couples with intimacy concerns, with sensitivity to each client's values and spiritual beliefs. She has specialized training in difficulties with sexual desire and functioning, compulsive sexual behaviors or unhealthy sexual boundaries, and marital and relationship issues. She also conducts educational events and presentations on sexual enhancement for couples and individuals. Dr. earned her doctorate in community psychology and research from Wichita State University and her master's in marriage and family therapy from Friends University here in Wichita. So I'm excited to welcome Dr. Pearson back to Cancer Connections. She's been a gracious presenter for us several times and is always a very popular presenter. So I'll turn it over to her and she's going to manage her own slides.
All right, thank you so much for that kind introduction. So my hope today is that we can talk about the medical and cancer-related causes of some sexual difficulties or dissatisfactions, including the cognitive, emotional, physical, behavioral, and relational factors. And then if we've got time, look at ways we can redefine what is satisfying sex and look at ways to enhance our intimate experiences. So to begin, I really stress the importance that sexual health is essential. It is important. Sexuality is a normal part of life, even though not everyone might be participating in sex with themselves or with a partner or partners. Everyone is a sexual creature. And a lot of times sexual health gets ignored or forgotten at times. And satisfaction with sex is a quality of life issue. We've really seen in our practice that the pandemic has really impacted people's intimacy, their comfort with touch, their interaction with touch, and for people in relationships, their comfort with their sexual health. Because the average adult does not necessarily have a good, thorough, or accurate understanding of sex. I like to ask my clients about their sexual self-esteem. How do they view themselves as a sexual person? Do they embrace their sexual identity? Do they think of themselves as sexy? And looking at their body as it may change with age and medical factors, because we're all constantly going through ebbs and flows of life, hormonal changes, medical changes, stress with things like the pandemic, and different ways that we interact with one another. So some common concerns that I see in my practice are concerns around partner communication. That could be around time management, that could be around interacting with the kids, that could be caring for an aging parent, caring for each other through cancer diagnosis and treatment. Also see a lot of concern around sexual boredoms or ruts. Couples that have been together for quite some time where it's I do this and you do this, and finding ways to kind of spice it up, keep it fun. Concerns that individuals may have around their fantasies and attractions, concern they may have with differences around frequency. And in heterosexual couples, it's not always the male that may be wanting to have intimacy more frequently. We see a lot of women that really appreciate touch and sexual intimacy and may want it more frequently than their male partner may. Also concern around difficult negotiating differing sexual needs, tastes, preferences, and concern around infidelity. Now, the American Cancer Society estimates that approximately 90% of cancer survivors experience some alteration in their sexuality. This might be how their body looks, how it functions, how they feel about themselves, their level of sexual desire, and their attitudes about being with their partner. There's a lot of body changes, there's a lot of functioning changes, appearance changes. As I'll talk about more later, attitudes around what's everybody's role in the family. Maybe a partner has become more involved with helping with childcare or being primary breadwinner or having different roles within the family, and that all affects intimacy. So some factors that contribute to sexual problems can be a lack of accurate information, So if a client is struggling with sexual skills or they don't know a lot of effective sexual techniques, maybe they have some misinformation. I do a lot of psychoeducation with my clients around, intimacy doesn't look like it does in the movies. You don't just, kiss for 5 seconds and the music starts and everybody's having a good time. There's a lot more work to it. Our health status, possibly due to cancer or radiation or chemotherapy, and all the things that can come with that, including nausea, diarrhea, chemical menopause. A lot of those things aren't aphrodisiacs. Lymphedema, surgery, scarring, neuropathy, loss or change in the shape or the sensation of the breast. All of these things can reduce our desire or arousal. Lowered estrogen levels can result in decreased lubrication or sexual pain due to vaginal dryness or atrophy. Vaginal tissue can decrease in size, and urinary tract infections can be more common. And for most of my female clients, all of these things can contribute to pain and feeling like sex is a lot of work. It's not as easy as it used to be, and that's going to decrease desire. And then our psychiatric health, if there's anxiety, depression, forgetfulness, memory loss, body image concerns, that may come with cancer diagnosis and treatment. Additional factors, medications like SSRIs, any bone pain, stress and fatigue, again, from the meds, from the chemo, anxiety, depression. Lack of sleep is a huge factor for people. If our body is tired, it becomes a lot more difficult to get in the mood, to feel aroused, to orgasm. Pain from cancer, tumor, surgery, chemotherapy, radiation, any relationship issues or conflicts that may be occurring, any personal history around sexual concerns, and then culture and beliefs or attitudes around sex. Finding ways to challenge those societal norms about what is normal, what is healthy around the roles and rules of sex, and any irrational beliefs or expectations. So I work with a lot of my clients that if your expectations for sex come from pornography or come from all those great romance novels or come from watching Lifetime television movie, all those things can be fun, but they're not real life. That isn't what sex really looks like for most people in the bedroom. So helping people create some realistic expectations. Questions about anything thus far?